great organization, and we'll talk more at lunch, but I just want to make a couple of announcements. Most importantly, the bathrooms. Go out this door, take a right, and they're right out there. And lunch is at 1 o'clock today. It's from 1 to 2, and it is upstairs. It's actually in the room right above us. Okay? So I would like to present Veronica. She is going to introduce our speakers for today.
I'm Veronica Cardinelli, and I'm the clinical coordinator for the radiation therapy program at Gateway Community College. And Jay Viola and I are currently the Connecticut reps for this lovely organization. And I, along with Jay, put this presentation together. Sorry it was like Easter weekend. Maybe next year we're going to try to plan a little bit better so that we could have more attendees. And if you have a good time, please tell your fellow coworkers to join our lovely organization, because we are small. We get to know each other very well, and we can have topics on the evaluation so that we can improve and make it a wonderful experience for everyone. And I'd like to introduce you to James Lucas. James is my partner in crime at Smilo Cancer Center at Yale. And he is a nutritionist and very informative. He does in-services for my students to inform our cancer patients on how to maintain a healthy nutritional diet while they're undergoing the treatment. And when you're getting cancer treatment to the various body parts, you have to adapt your diet accordingly in order to do and have a better response for the treatment, and your normal tissues repair quicker, and the overall experience is great. But not only does James do that for our patient, he has his own business, and he's just great. So I'm just going to tell you a little bit about James. James is a graduate of the University of Connecticut, where he earned his bachelor's degree in nutritional science with a focus on nutrition for sport exercise. He worked as a nutritionist for the Torrington Area Health District Women, Infant, and Children program. Then he went to become a registered dietitian and is certified and graduated from Yale New Haven Hospital dietetic internship. He has worked with me at the Smilo Cancer Hospital for 5 years, and he's currently completing his master's degree in exercise physiology at Southern Connecticut State University, and expects graduation in May. He's having a party, and guess what, I'm going. He recently started up his own nutrition and exercise practice and is a certified retail supplier for several sports nutrition supplements. I'm his guinea pig, so when he gets new things, he lets me try them. Some are good, and some, they're taxing. He's a member of the Academy of Nutrition and Dietetics, the Oncology Nutrition Dietetic Practice Group, the Sports Cardiovascular and Wellness Dietetic Practice Group, and the Collegiate and Professional Sports Dietitian Associates. It is my pleasure to introduce our first speaker, James Lucas, who will speak to us about nutrition for a healthy, active lifestyle. Let us welcome James.
Good morning. Thank you, Veronica, and hope everyone is well nourished and ready to hear about some nutrition. Hopefully I can give you some information that you can carry for a lifetime and that can help optimize your health overall. Throughout the presentation, please use your notepad and pen for any questions, and we'll reserve some time afterwards to address any questions. So the title, Nutrition for a Healthy and Active Lifestyle. We'll go over primary prevention, reducing risk for chronic disease, cancer, diabetes, hypertension, heart disease, and osteoporosis, which is ever so prevalent in today's society, as we will see by some statistics. And we'll get back to basics with nutrition and the principles of nutrition. I'm sure that we often hear a lot of different rules and regulations as far as how much carbohydrates and fat and protein we should eat. And I would like to try to give you some guidelines according to scientific information. We'll go over some nutritional facts and some nutritional fiction, which we'll try to dispel some common nutritional myths, and we'll review some fad diets. We'll also go over the principles of weight management, diet, and exercise. We'll also cover supplements, vitamins, and minerals, and we'll discuss to see if they may be necessary. By a raise of hands, anyone here take multivitamins out of curiosity? Okay, very well. So, it is the position of the Academy of Nutrition and Dietetics that primary prevention is the most effective and affordable method to prevent chronic disease, and that dietary intervention positively impacts health outcomes across the lifespan. So nutrition really is my focus and something that I love and something I want to encourage others to be more mindful of. Of course, we eat every day, 3 times a day at least, and we want to try to maximize our nutritional intake for primary prevention to reduce these chronic diseases, diabetes, cardiovascular disease, and obesity, so that we can enhance the quality of life, so that we can delay healthcare costs, and so that we can maximize longevity. So when we have these interventions in our back pocket, that's when we get a response such as this. You've got a rare condition called good health. Frankly, we're not sure how to treat it. So when we may have poor dietary habits and physical inactivity, we're mindful that it may lead to overweight and obesity, cardiovascular disease, diabetes, cancer, and osteoporosis. The statistics on overweight and obesity are 1 in 3 adults in the US are obese, 72% of men and 64% of women are overweight or obese. The economic burden of overweight and obesity is about $147 billion per year. Overweight and obesity are associated with comorbidities such as type 2 diabetes, cancer, hypertension, and a myriad of other factors that we see. What is obesity and how is it classified? Well, according to the body mass index, if a value is 30 or higher, that would indicate obesity. There are 3 different classifications of obesity. 30 to 35 is class 1, and 35 to 40 is class 2, and 40 above is class 3. How is it calculated? We take weight in kilograms and divide it by your height in meters squared. If that's a little bit too mathematical, then maybe we might want to use a chart of this nature. As you can see, here you would look at your height across, and it doesn't distinguish between male or female, but for myself, I'm about 165, 170, so go across and go for height 5'9", somewhere in this range here, 27. There's some discrepancies, of course. If we look at 27, that means I will be overweight. So sometimes you have to account for lean body mass. For example, my buddy that's actually recording this, he's very lean, and his body mass index might actually be in the red zone, but it's just because he has a higher percentage of lean body mass or muscle. So there's some discrepancies. You can't allow yourself to be categorized by this alone. You have to look at body weight distribution. So this discusses where the fat in the body may lie. As we have heard, fat that is stored in the central area is more associated with chronic disease such as diabetes, cancer, and heart disease. Your waist to hip ratio is also important to modify. When the waist is greater than 36 inches in men and greater than 32 inches in women, it's associated with long-term health complications. No worries, we have the interventions to help prevent chronic disease. So, cardiovascular disease, the leading cause of death in the US for more than 100 years. It accounts for 1 in 3 deaths. And according to the American Heart Association, in 2010, 81.1 million Americans, 37% of the population, had cardiovascular disease. The economic burden in 2010 was $316.4 billion. How about if we can get some of that money back in our pockets? That would be nice, huh? So what are some of the risk factors for cardiovascular disease? Dyslipidemia, glucose intolerance, hypertension, obesity, smoking, and physical inactivity. So, although the positive impacts of dietary change have been clearly demonstrated, less than 1% of the U.S. adult population have a diet considered ideal when compared with American Heart Association 2020 goals. Now, to speak on diabetes and some statistics, 18 million U.S. adults, 8% of the population, were diagnosed with diabetes in 2008. Nearly 24 million people, almost 11% of the population, ages 20 years or older, have diabetes. The majority of cases are type 2. As we know, there's type 1 and type 2, which type 2 is heavily influenced by diet and physical activity. About 78 million Americans, or 35% of the U.S. adult population, greater than age 20, or 18 or older, have pre-diabetes, which basically means that there's an impaired tolerance or impaired fasting glucose. There's some indications that someone may be at risk for diabetes. And diabetes prevalence is projected to reach 33% by 2050. Let's begin today to inhibit this increase in diabetes. Some of the risk factors would be obesity and family history, hypertension, low HDLs, or the good cholesterol, a high triglyceride level, dietary patterns, and physical inactivity. Hypertension, high blood pressure. 74.5 million Americans, or 34% of the U.S. Adult population, have hypertension. Hypertension is a major risk factor for heart disease, stroke, congestive heart failure, and kidney disease. Dietary factors that increase blood pressure include excessive sodium and insufficient potassium intake, which can come from more fruit and vegetables, overweight and obesity, and excess alcohol consumption. 36% of American adults have pre-hypertension. Now to move on to cancer risk. Excess adiposity, poor dietary patterns, and physical inactivity can increase risk for colon, breast, uterine, esophageal, and renal cancers. Alcohol beyond moderation, meaning more than 1 drink for women and 2 drinks for men, increases risk for head and neck, liver, and breast cancers. So, lifestyle changes along with early detection can prevent nearly half of all cancer deaths. As we'll go on in the presentation, we'll talk about which alcohol drinks you may want to choose, which might be a little better for health. Your diet is one of the most important factors under your control that can reduce risk for cancer. As noted, overweight and obesity can increase risk overall for different cancers. Most recently, I believe there was an indication for uterine cancer and overweight or obesity. So cancer claims more lives than heart disease. I mean, I see cancer at my job, and it's definitely something that no one wants to go through. And there's some factors that we have under our control and some that we don't have under our control. So overweight and obesity is associated with 14% of cancer deaths in men and 20% of cancer deaths in women. And in the US, men have a slightly less than a 1 in 2 lifetime risk of developing cancer. For women, the risk is a little more than 1 in 3. Osteoporosis, bone health. 1 out of every 2 women and 1 in 4 men ages 50 years and older will have an osteoporosis-related fracture in their lifetime. And about 85 to 90% of adult bone mass is acquired by the age of 18 in girls and the age of 20 in boys. Whenever I speak with high school athletes, I always try to emphasize adequate calcium intake because, as we may know, that is the time frame when bone mineral density is solidified. So it's always important to encourage your loved ones or your children, if you have children, to keep their calcium intake adequate. Adequate nutrition and regular participation in physical activity are important factors in achieving optimal bone mass as well. So now we have all these stats and risk factors. Now we'll begin to talk about the intervention, which is modifying weight via diet and physical activity patterns. So that is done by looking at the 6 essential nutrients for life, the macronutrients, carbohydrates, protein, and fats. and the micronutrients, which we will obtain from the carbohydrates, fats, and protein that we eat each day. Vitamins are necessary to facilitate use of other nutrients involved in regulating growth and manufacturing hormones. Without taking in adequate carbs, protein, and fat, and just taking in vitamins alone, you're not optimizing health, you're not optimizing life. For example, we have fat-soluble vitamins, and without fat in the diet, those vitamins cannot be absorbed and utilized. Minerals, of course, calcium, etc., help to support bone health, teeth, and aid in muscle function. Of course, we always want to stay hydrated, which I think I need a glass of water. Help dissolve and carry nutrients. I think I just felt some nutrients transporting across the lumen of the stomach. So we have 6 main food groups: fruits, vegetables, grains, protein foods, dairy, oils, things that the USDA tried to help us with, and they've been trying for many years. We may recall this whole pyramid here, I believe, developed maybe in 1992. It was around from 1992 to about 2005, and obesity rates are still climbing, so I guess they tried to change their intervention, and they came up with my pyramid. Now this one here doesn't have any written guidelines on it, like the other one, like, okay, eat 6 to 11 servings of grains. This one here tries to give you a picture of what to eat, but I'm not sure how good of a job they really did. I guess only about 2% of the US population really follows these guidelines. Does anyone really understand what this means? Raise their hands. So, I kind of like the picture, honestly.
Popcorn up there?
Popcorn is up there, that's a grain. So I guess they're trying to say that, you know, the base of the pyramid, this is where the whole grains would be, and then your more refined processed foods are more at the top. You know, same thing with your vegetables, more processed canned vegetables here. You know, I'm sorry, up in this section, but more fresh, whole. Same thing across, basically. And then the yellows, your oils, and of course always physical activity. So they found this wasn't effective in 2005, so they came up with this new guideline as of 2010. ChooseMyPlate.gov. Anyone seen this one? Make a little more sense?
Yeah, that's much better.
Anybody use this one? All right, so.
I think Americans eat double that, so you have to add another plate.
We'll talk about how we can maybe get a little more closer to this plate method. So we want to balance calories, and this is what the USDA is encouraging, and this is how they tell us we should eat in order to manage our health and weight. So you want to enjoy your food, but eat less. Avoid oversized portions. And foods which you should increase, you want to try to eat more whole grains by making half your plate fruits and vegetables. I'm sorry, more fruits and vegetables by making half your plate fruits and vegetables. Personally, I don't really like to eat fruit that much with my lunch or dinner, but it's a personal thing. And also we want to make sure we're having calcium-rich foods by taking in more fat-free, low-fat milk, etc. And reducing sodium, of course. So they say for fruits, fruit is any fruit or 100% fruit juice. It can be fresh, canned, frozen, dried, whole, cut up, or pureed. So sometimes you may hear, oh, don't eat that canned fruit and so forth. Well, that canned fruit may be better than eating no fruit. So it's about optimizing where you can. And then looking at serving sizes. 1 cup of fruit will be considered a serving, or 100% fruit juice, half cup of 100% fruit juice, or a cup of dried fruit. So you want to aim for 2 cups of fruit per day. And fruits contain potassium, dietary fiber, vitamin C, folate, to help reduce chronic disease risk. Here are some samples of some servings. And believe it or not, today, I actually have some serving sizes for you guys to check out, so you can pass them around, just to help capture what a serving would be. There we have half of a grapefruit, that will be equal to 1 serving, and 1/4 of a cantaloupe. And also, I brought another one. Here is a serving of juice. This is a major factor, I believe, that can be modified in the diet to help control weight gain over time. I mean, 1 serving, I think that we may be more apt to drink maybe 4 times this amount.
How many ounces of that?
This is 4 ounces.